and you'll see some very powerful things happen in a short period of time.
Thank you. Dr. Stoll, so there's a lot of medical doctors that don't preach or advise their patients to have a whole food plant-based diet. So why do you, what studies have you seen? What's influenced you? What's made you come to the conclusion that a whole food plant-based diet has a benefit that you would recommend to your patients where most doctors are still not recommending that?
Yeah, there's a famous quote from Maya Angelou that said, she says, "I did then what I knew how to do, but now that I know better, I do better." Mm-hmm. And for most of us, in medical school, we received 19 hours of nutritional education. None of that is the nutrition of disease prevention, suspension, or reversal. It's largely hospital-based nutrition. And so we really don't know. We don't know the science. We don't know the evidence. The specific studies are growing in number. And, early on, there were the studies of Dean Ornish, Caldwell Esselstyn. There's a large study in Iran looking at reversal of heart disease, had the same conclusions as Dr. Dean Ornish. We have, interesting studies looking at disease reversal from several different angles, looking at diabetes reversal. Very nice study that compared a vegetarian diet to the American Diabetes Association diet. And it was interesting because they not only compared the medication reduction, insulin levels, but they also compared some very important markers looking at the body's antioxidant capacity and anti-inflammatory levels. And they found not only was the vegetarian diet superior, but when they compared the diet at a more cellular level, the American diabetes diet did not impact in a positive way at all those antioxidant measures. But the whole food plant-based diet not only had a superior reduction in medications, improvements in blood sugar, but dramatically changed the cellular level as well. And that kind of just stepping out and looking more globally at some studies, when we look at large meta-analyses, we find that in probably 3 different studies in the last 5 years, they've recommended 10 servings for 800 grams of plants as the optimal way to prevent, suspend, and reverse disease. And they found that it's a dose response. So every single serving you add has benefit. And I think that's really encouraging that, there is benefit in adding the single serving of plants every day. You can start and move along that spectrum. The longest lived and greatest weight reduction of any study came out of New Zealand, where they simply recommended a plant-based diet, did not intervene with any exercise, and found that people were able to sustain and lose weight on a plant-based diet for a number of reasons. We also have studies showing that not only, as Cyrus is talking about this, and I'll let him talk about it more later, can you improve your blood sugar levels, reduce insulin resistance, but with the right diet, and if you have beta cell functioning, the cells that produce insulin, can improve the function and sometimes improve the numbers of active functioning beta cells in the pancreas that produce insulin. And I'll just end with one study that I think is so impactful because it's a condition that's very difficult to treat. It's diabetic neuropathy, which is painful nerve pain in the legs, secondary to the tiny blood vessels being injured by high blood sugar levels. And it causes severe pain in the feet. Sometimes you can't even put a sheet on your feet, and medicine does not have a good solution for that. They use neuropathic medications that cause weight gain, fatigue, and a host of other problems. They found when they transitioned people to a very intense interventional whole food plant-based diet, the diabetic neuropathy was reversed in as little as 2 weeks. And so this is really good news for people that have severe pain, that they can suffer from this condition for years, but with just 2 weeks of the right diet, they could actually step in and be pain-free. And there's more we can talk about, but I'll stop there.
Thank you. Carla, can you tell us what are the 9 key factors that Kelly wrote about in her books as the common themes that all the people who are beating cancer were doing?
Yes, I would love to. And in fact, there is a 10th factor that got added later and was written about in the follow-up book called Radical Hope. I'll start there. That 10th factor is exercise. So when Dr. Turner did her research, many of those cancer survivors she was talking to had been through medical treatment and were sent home on hospice. The medical community had nothing more they could do for them. And so those people were too weak to exercise. So later, Dr. Turner wondered why, because there's so much additional research that tells us that exercise is good to prevent a diagnosis, to get through the treatment, and to prevent a recurrence. So she looked back at her research. She went back through some of the interviews. She talked to some more people. And what she realized is that all of those survivors initially were moving their bodies as much as they could when they could, but they weren't doing exercise in the traditional sense of the word. You know, they weren't running marathons anymore, lifting weights in the gym, that kind of thing, but they were moving. And so we have to reframe exercise to be physical activity. So physical activity is what makes a big difference. The other two physical factors, so of the 10, there are 3 physical factors. The other 2 are diet, so changing your diet. And there is no one single diet that came out of this research. And then the third is herbs and supplements. And that's the one factor that we recommend everyone find a licensed practitioner to help them determine what herbs and supplements is going to do the most to help them through their diagnosis. And then the other factors are emotional, mental, and spiritual. So we have empowerment. When you're taking charge of your health, you become the CEO essentially of your health, and you treat your medical practitioners and healers and acupuncturists and whoever you might have on the team as the experts in their field of expertise, but not as an expert on you. Then there's intuition. So going within, taking the time to be quiet and listen to that still small voice inside of you that's connected to a higher power that helps you determine what's the right thing for you to do, what's the right decision. And there is also emotional things like increasing our positive emotions. The more love, laughter, joy, and happiness we have in our life, the more our immune system is being boosted by those happy hormones that get released. So it is talked about as a muscle that needs a workout on a daily basis. And then there's also releasing suppressed emotions. So in this factor, all of the survivors that Dr. Turner talked to indicated that they had to release negativity or release trauma or release some negative low vibration emotions in their lives so that they could clear those blockages. And it's about stress and fear and forgiveness, all of that sort of thing. There's also a piece of it that was most surprising to Dr. Turner was the nostalgic piece of it. So those people who didn't come forward in their lives, those people that were living in the past, they were nostalgic, not just fond, happy memories, but they were living in the past. So think about the captain of the football team. The glory days are back in high school when he was the captain and things were going great, right? And if he's now a 40-year-old man and he's not as happy with his life, he might still be living back there in the past, wishing that he could still be the captain of the football team. Or perhaps there's a prima ballerina that can no longer dance. And, you know, it's about living in the past and not living in the present moment. So that's another piece of releasing. We also have social support. So asking for and receiving love and support is really important. And it's a very different skill than giving. Most of us are really good at giving support, but we're probably really bad at asking for it because we feel like if we ask for help, that's a sign of weakness. And in fact, it is just the opposite. The best thing that you can do for yourself and the bravest thing you can do for yourself is ask for help. And social support, we know that loneliness is a horrible thing. You know, we've learned since the pandemic how much loneliness can affect us and our health. So having the right social support is really important on a healing journey. And then we have spirituality. So all of the radical remission survivors deepened their spiritual practice, whether they were religious or not. You know, it's you can be spiritual and religious, or you can be religious and not spiritual. You know, it doesn't matter. You need a connection with something bigger than yourself. Having that connection to a higher power makes a big difference in your ability to maintain your hope and your faith and your belief that you can get well and that there's good reasons to do so. And I think the 10th one, I think I got them all. Strong reasons for living. Strong reasons for living is about having meaning and purpose in our lives. And for some of us, it's an automatic, well, I have my kids, and then I'm going to have grandkids, and then, you know, I've got all their milestones to look forward to. Not everybody has kids, and our strong reasons for living will change over time as our kids grow and become adults, and they don't need us quite as much. While they'll always be our kids, we might have different strong reasons for living. There may be a creative endeavor that you want to write that book or paint that painting. You may find a lot of meaning and purpose from the volunteer work that you do. Your career can certainly bring a lot of meaning and purpose. You just got to be careful when you retire that you have something else that's going to really fill that need for you. So the strong reasons for living, you know, it really gives us something to not only fight off death, but really to have a zest for living, which is really important when you're trying to overcome a diagnosis.
Thank you.
Yes.